Imagine you're in a situation where your own memories are slipping away from you. Have you ever wondered why someone close to you suddenly stops recognizing you? Do you know how many people are struggling with this condition? Or have you ever thought that you or a family member might face this problem? Today, we will talk about a disease that steals our memory, dementia. But don't worry, we understand this disease, and through this video, we will try to explain everything about it to you. So let's get started. We will look into what is this? How many types are there? What are the symptoms? What causes it? How can it be prevented? How is it diagnosed? What are the treatment options? And finally, the conclusion. First, we will understand what is dementia. Let's see. Dementia is not a specific disease. It's actually a term that describes a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily functioning. Imagine this. You or someone you love starts forgetting recent conversations or where they placed everyday things like keys or a wallet. That's what dementia can look like. I hope you now have a bit of an idea about dementia. Let's move on to the next point where we will learn about its types. Let's look at its types and understand them one by one. There are several types of dementia, each with its own causes and symptoms. Let's talk about a few, such as Alzheimer's disease. This is the most common type, making up about 60–70% of dementia cases. People with Alzheimer's slowly lose their memory and cognitive functions. Next, vascular dementia. The second most common type, it happens due to microscopic bleeding and blood vessel blockage in the brain. It often occurs after a stroke. Next, Lewy body dementia. This type involves abnormal deposits of a protein called alpha-synuclein in the brain. It affects thinking, memory, and movement. Next, frontotemporal dementia. This affects the front and sides of the brain. It typically involves changes in personality and behavior. Next, mixed dementia. Sometimes a person might have more than one type of dementia, like Alzheimer's and vascular dementia together. Friends, these were some common types of dementia. Now, let's move to the next point, where we will learn about its symptoms. Dementia has many symptoms, but in this video, we have covered some common ones. Here are a few common symptoms of dementia. The symptoms of dementia can vary significantly depending on the type and stage of the disorder, but generally, they involve a decline in cognitive functions and other abilities that affect daily life. Here are some common symptoms associated with dementia, such as memory loss. This is often one of the first signs. It might be subtle at first, like forgetting recent conversations or events. Next, difficulty with everyday tasks. Tasks that were once familiar, such as handling money, driving, or balancing a checkbook, can become challenging. Next, problems with communication. Individuals may struggle to follow a conversation or find the right words. They might repeat themselves or forget the thread of what is being said. Next, disorientation and confusion. People with dementia may get lost in previously familiar places. They might lose track of dates and times or have difficulty understanding events happening around them. Next, personality and mood changes. Changes in mood, such as increased irritability, depression, or anxiety, are common. The person may also show rapid mood swings for no apparent reason. So friends, those were some common symptoms of dementia. If you have information about any other symptoms, please write them in the comment box. Now, let's move on to the next point. What are the causes of dementia? Let's see. Here are the main factors that may contribute to the development of dementia, such as age-related changes in the brain. Age is the most significant risk factor for dementia, especially Alzheimer's disease. Changes in the brain, such as atrophy, inflammation, and the accumulation of abnormal proteins contribute to dementia. Next, genetic factors. Certain genes increase the risk of developing dementia. For Alzheimer's, the APOE4 allele is the most well-known risk gene. Other forms of dementia, like frontotemporal dementia, also have strong genetic links. Next, vascular factors. Conditions that affect blood circulation like heart disease, stroke, and atherosclerosis can lead to vascular dementia by reducing blood flow to the brain. Next, neurological diseases. Several neurodegenerative diseases, such as Parkinson's disease and Huntington's disease, can lead to forms of dementia associated with these conditions. Next, head injuries. Severe or repeated head trauma can increase the risk of certain types of dementia. These were some common causes. Now let's move on to the important points, where we will learn how it is treated. Dementia can be treated in several ways. Treatment for dementia typically involves managing symptoms and supporting quality of life, such as medications. Cholinesterase inhibitors and memantine can help with symptoms of Alzheimer's disease, the most common form of dementia. Next, therapies. Cognitive behavioral therapy and other forms of psychotherapy can manage mood and behavior changes. Next, lifestyle changes. A healthy diet, regular exercise, and cognitive stimulation can support brain health. Next, caregiver support. Education and resources for caregivers are crucial to ensure effective care for individuals with dementia. Next, safety and comfort measures. Adjustments in the living environment can help prevent injuries and aid in daily activities. Friends, these were the methods to treat dementia. If you feel any point was missing in this video, please do let us know in the comments section. Finally, let's look at the conclusion. Dementia is a challenging condition, not just for those diagnosed, but also for their families and caregivers. Understanding dementia is the first step towards managing life with it. If you or someone you know is showing symptoms, consult a healthcare provider for a proper diagnosis and support plan. Today's discussion about dementia. I hope this session was informative and helpful. Remember, understanding dementia is the first step towards effective management and support. If you found this video useful, please like, share, and subscribe for more content like this. Stay tuned and take care of yourselves and each other. Thanks for watching, and see you in the next video.